certainly we are very involved in this in the outpatient setting, whether it's the pharmacy team themselves or the other financial teams that, again, are part of that collaborating group of people that help facilitate care for this patient. So I think one of the things that we know and address specifically with our oral oncolytics in this particular realm for CLL is that we, at any point, any patient assistance that is available, we have patient care advocates within our team who are trained pharmacy technicians who help assist these patients. And that can be quite an involved process sometimes. Sometimes, the insurance is such that it will, there will be some roadblocks before we are able to get the drug to the patient, simply because, as you pointed out, it's not just getting the approval, it's making sure the patient can actually afford once their copay comes back, and it might still be a daunting fee. So we have a whole process in place. We work closely oftentimes too with those that provide these drugs, the companies that do provide these drugs for any patient assistance that might be available. And I think the bigger picture, and what we're all, especially in oncology, very cognizant of these days, is that oncology care model and how that's going to affect things down the road, because we want to make sure that the therapies we're choosing, obviously there's good data to support that option, but also then, like you're bringing in the component of affordability, and is there sometimes a stepwise approach to what agents we should be using based on their efficacy as well as the cost to the patient, to make sure that what we're choosing is actually a realistic thing for them to get. So there are pieces in place for them to get that assistance, but all of these things take time in a very sort of methodical way of assisting them with their copays, let's say.